Well, tomorrow is National Nurses Day, a day to celebrate and show appreciation for nurses and the absolutely vital work that they do. But it comes at a time when nurses are under more pressure on the job than ever before.
A recent report by the National Council of State Boards of Nursing found about 100,000 registered nurses have left the profession since 2020, and more than 500,000 more say they intend to leave by 2027. They blame stress and physical and emotional burnout. Joining us now to discuss this are Latisha Hanson, an assistant professor of nursing, and Michelle Charles. She is a psychiatric nurse practitioner program doctoral candidate at Columbia University School of Nursing.
Thank you both for joining us, two of our healthcare heroes. We appreciate your time this morning. We appreciate the work that you do. So look, I think it's not a surprise coming out of the pandemic that this field, nurses feel taxed. They're physically and emotionally drained. Latisha, I'll start with you. What kind of stresses are nurses and nursing students facing on the job every day? Put it in context for those of us who don't do this.
The nursing shortage and the burnout has led to nurses to feel overwhelmed. They're exhausted. They're tired.
And what is the impact for all the nurses then, Latisha?
It takes a mental toll on nursing students and also on nurses. The increased levels of depression, increased levels of anxiety, feeling overwhelmed. They're exhausted.
So, Michelle, it's not just nurses who are experiencing high levels of depression, stress, and anxiety. Many of their patients, they're also going through some of these same issues. How are nurses able to approach mental health care, and how does this impact the type of care that nurses can give?
Absolutely. So I think we saw during the pandemic, these rates of depression, anxiety, they started to skyrocket. And, we just didn't have enough providers to provide all the care that we needed. Nurses in advanced practice roles can do so much. We can prescribe, we can diagnose, we can treat mental illness. And I think it's a great place for nurses to be.
Absolutely. It's something that we totally need. Also, every study that we're seeing shows how much more support society needs in that regard. Latisha, I'm wondering if there's any specific strategies that you're teaching students to help them cope with the physical and mental stressors of the job, especially as it has been a really taxing time in many ERs and many urgent cares as we've been dealing with COVID. What do you tell your students about that?
Well, first is to notice when you're feeling overwhelmed. Notice when you need to recharge your battery, when you're feeling drained. If you've noticed that you're making mistakes or that you're not having enough sleep, changes in appetite. So first noticing when you're overwhelmed. And then there's steps to take to help recharge your batteries. Like, for example, having time for yourself, saying no, being able to turn off electronics, help reduce fatigue, eating well, and also spending time with others, being able to talk to your other fellow nurses, people in your family, being able to have community support is also a big help for nurses. So I think there's a number of ways that we can work together to help reduce some of the burnout that we're experiencing.
And Michelle, those last points right there that Latisha mentioned, being open and talking about it, that can be some of the best ways to deal with mental health. But right now, patients, they're facing long wait lists just to get an initial visit with a provider or perhaps a therapist or someone who can help them. So what can people do in the meantime if they're on a wait list for services, if they're struggling to get what they need right away?
Absolutely. I think one of the greatest things you can do is be really open to other modalities like group therapy. And some people, they'll go to group therapy as a way to tide them over until they can find an individual therapist or provider, but then they find that they love group. So I think, just remain open.
All right. Latisha Hanson and Michelle Charles, thank you both so much for everything that you do, and thank you for joining us for this important conversation this morning.
We appreciate you, and everyone at home, show your gratitude for our healthcare heroes. Thank you very much, both of you, for joining us.